Hi guys, I hope you've all been keeping well. Welcome to today's virtual training. Today we're going to be having a look at the relationship between internet, screen time and mental health in relation to our students, young people and children that we work with. As the internet and technology continues to play a bigger and bigger part in our lives, it's important that we consider the effects that this could be having on the mental health of our students. This may feel particularly important in the wake of the current events of COVID-19. While the positives and the contributions that technology makes to our lives have really shone during this time, there's also been a lot of concern over the effects of this, massively increased amount of screen time and internet time and the effect this has on our students. Quickly before we begin, I just want to recap on what we mean when we're discussing mental health. The World Health Organization defines mental health as not just the absence of mental disorder, it is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So it's just worth keeping this in your mind as we move through this training. That's what we mean when we refer to mental health. So the aims of this session are to explore the different ways the internet is used by children and young people, to understand the impact of the internet and social media on the mental health of young people, and to feel confident knowing ways we can support young people to look after their mental health while they're using the internet. The World Health Organization recently suggested that screen time for children should be reduced as much as possible to reduce the risks of any adverse health effects. The media is often filled with a lot of very similar statements and headlines, and I'm sure we've all seen these around. Today we're going to have explore the research in this area and what it's saying and the extent to which these headlines are true. We're also going to look at the different types of screen time and what we mean when we say this word screen time, and the ways we can support children and young people to manage their internet usage and screen time. So the first thing I thought we'd do would be just to move into groups and have a bit of discussion, so get some thoughts thinking about what it is we mean when we're talking about screen time and internet usage. So in groups, discuss all the activities that can now be done using a screen. So for example, people are now using Amazon Kindles and Apple Books to read books, where previously they would have been reading physical hard copies of books. So it take about 5 minutes in groups to come up with different kind of examples that you can think of that in similar ways we've moved from doing physical activities to things that we now do using a screen. If this is still being done remotely, given the situation, and you're doing this independently at home, just put together your own list. It's worth pausing this for 5 minutes to give you guys a chance to discuss them or write them down, and then we'll play it again. So I hope you've had some time and been able to come up with some ideas around this. It's now, if anybody wants to share and discuss these ideas, again, you can pause this and have a larger group discussion as well. The point in this activity is to highlight the huge variety of activities that fall under this very generic label of screen time. It could be seen as a bit of a buzzword, screen time. We see it around all the time, but when we say screen time, what do we mean? Because it may look to the observer that when your child is just staring at a laptop screen for hours on end, it could just look like they've just been on the laptop for hours. Although in this time they could have been using their laptop for a couple of hours, yes, but in that time they may have been doing several different activities that use completely different skills, with different programs, different apps, engaging with different people. So it's important that we think about what exactly it is we mean by screen time. Similarly, when you look around as you're sitting on a bus, everyone may appear to be staring at their phones, or when you're on a train, everyone's looking at their phone. But actually, what could be happening could be one person could be listening to music, some people could be learning something from podcasts, some people could be watching videos, emailing family members, ordering online shopping, downloading new apps to learn new languages. They could be working remotely using their mobile. So this just highlights again the need to consider the what and the why of people's screen time, rather than just looking at how long they're using it for, how much screen time they're getting. What is it they're using and why they're using it? Because these are really important to consider as well. It's also to show that although they're doing these activities online, people are still enjoying all the same activities that they used to do, just now they're in a more compact and accessible way. And therefore, when we think of things like this, things may not actually have changed as dramatically as we may think they have. While previously people, for example, played solitaire with a pack of cards, they're now playing the exact same game. They're just doing it on a tablet instead. The same for reading books. We're now doing it on Kindles because it's more transportable, more convenient, and it's also better for the environment. So it's worth considering these things as we move through the training, and the possible benefits that moving to this way of doing activities has as well. So as we've just discussed, thinking about screen time as a concept is not helpful because it can refer to such a wide range of activities. These are just some of the things that we thought of that we could be referring to when we say screen time. So you could be doing online training for work, you could be watching television, reading the news, you could be video calling, internet-based interventions, which could be for an absolute a whole range of things. You could be shopping, whether this be for fashion or whether it be for food. You could be video streaming, you could be job hunting, blogging, gaming, fitness tracking. Technology is so prominent in our lives now that such a wide variety of things fall into this category of screen time. And it's important to think about the differences between these different types of things as well. So gaming is very different to using screens for social media. Even social media as a concept is not particularly helpful because different social media has a different bases. For example, while Twitter is a text-based app, Instagram is a picture-based app. Also, the way people use these and what they're using them for can also vary a lot as well. So people could be, for example, using social medias as something part of their work, as part of their school. I know some schools do have school social medias that is used to share information, but also it could be used obviously for like personal reasons and keeping contact with friends and things like that too. So why we're using these different things is also important to consider. Furthermore, so video games, they also, like social media, break down into lots of little categories. The way people play Call of Duty may be very different from the way that people play The Sims. They're very different games. Yes, they both fall under the category of gaming, but they are very different. Instead, when we're thinking about the concept of screen time, we need to break this down into small parts. It's partly for this reason that investigating the mental health impacts of internet and screen time is very complicated, because it just covers such a wide variety of things. To complicate things further in terms of social media, they're engaged with differently as well as having different bases. For example, some are active while some are passive. So active social media use would include things like blogging or chatting with friends online, which can have positive effects on well-being. Whereas passive social media use, which would be just scrolling endlessly through information or pictures, rather than interacting with it, this can have negative effects on well-being. Finally, there is a tendency to think of a minute spent on the internet as being a minute wasted that we could have been doing something else. In psychology, this is something known as displacement theory. When we consider screen time in this way, it's important to consider the other ways that this minute may be spent, and whether what we would be doing other than being on the internet or on our screen time, whether this would be any more productive or healthy or have any more positive effects for our mental health. So this could also differ between different groups of children and young people. So for example, children and young people in rural countryside areas, this minute that they're on their phone or they're using their tech or they're gaming, this could mean a minute not spent playing outside in nature, something that we know is particularly good for our mental health and well-being. It could also be that the minute they've spent online could be a minute not spent with friends, socialising with friends, or it could be a minute outside of an extracurricular activity. However, for children and young people living in big city areas with high crime rates, a minute playing games could be a minute actually avoiding getting involved in that crime and gang culture. And therefore, we would see the minutes spent gaming or on the internet or on social media as being something that's actually healthier than the minute that they would spend off it. It does suggest that gaming could be better for the mental health of a particular child than it would be for another child. And this highlights the complexity of this area of research. So another short activity just before we carry on. I'd just like to ask you to discuss in small groups what are your main concerns on internet use and screen time, for the children, young people that you work with in their mental health? And also, what do you do at the moment to support these children, young people with their mental health when they're when it comes to using the internet and screen time? So again, if you're doing this individually, it's just worth having a think about. If you're in small groups, get some discussion going. And then once you've done this in smaller groups, if you want to open up into a wide discussion, that's great. Just pause this recording and then restart it once you're finished. So before we finally move on to look at what the data is actually saying, there's a couple more things I wanted to just mention about the research and the research in this area specifically. As we've already discussed, screen time is extremely complicated and therefore is difficult to accurately research. Also, because of the extreme rate at which technology is advancing, the research can't keep up. It's always behind where the technology is. So before we go on to look at this, is something to consider, that the research we have is not necessarily done with the most up-to-date technology, because the rate at which technology is advancing is it's too quick. So identifying causation is also difficult when it comes to this type of research, because although we might see a relationship between social media use and life satisfaction, it's difficult to know, is this person using more social media because they are dissatisfied with their life, or is this person dissatisfied with their life because of how much time they're spending on social media? So that's worth considering. Internet usage is also likely to affect people differently. So, for example, it's been suggested that different types of internet use may have different effects on boys and girls. Research looking at the impact of the internet on children's psychological well-being found that the strongest effects are found for how children feel about their appearance, and the effects for this were stronger for girls than they were for boys. So this is just one example of how the internet may affect different groups in different ways. There is little evidence on modern forms of digital media, as we mentioned above, because of the rate that technology is advancing at, and evidence also tends to be low to moderate in quality in this area, so that's worth bearing in mind. There's not enough research at the moment for us to be able to give out guidelines, so I imagine a lot of people were hoping from today that you'd get given guidelines on how much screen time we should be letting our children and students and young people have. For example, no more than an hour a day, no more than 2 hours a day. But where we are now and where the research is at the moment, this just isn't possible. If evidence eventually does become available so that we can give out these very fixed guidelines, it's likely that these guidelines will still be dependent on individual factors. So while some young people may be able to spend X amount of time online without it affecting their mental health, this amount of time might be a lot lower for other young people. So even if we do get to a place where we can have these guidelines, individual factors will still be very relevant and something to consider. There's still a lot we don't know, so also it has been suggested that the scope and the quality of the research we have at the moment still leaves us with many questions unanswered about the danger of screen time, but it's all we have available at the moment, so we're going to have a look at what the most up-to-date research that we have is saying. So what is it that the research is saying? A recent review of evidence has suggested that while there are moderately strong links between screen time and some mental health issues, potential health impacts are not as universal as we might think. So while there is evidence to suggest that screen time is related to some physical and mental health concerns, such as poor diet, obesity and depression, there was little evidence linking screen time with behavioural problems, anxiety and also concentration. Furthermore, moderately strong links between depressive symptoms and social media were found, and this is where we need to be aware of that causality issue that we talked about a moment ago. So are we seeing higher levels of depressive symptoms because people are spending more time on social media, or people spending more time on social media because they have a higher level of these depressive symptoms? There's also a moderately strong relationship between reported quality of life and screen time. However, there is no evidence linking screen time to other difficulties. There is sparse evidence linking screen time to poor cognitive development in children, and further research compared teacher and parental evaluations of children's social skills among children from 1998 to 2010 and found that children's face-to-face social skills are not getting worse even when screen time is accounted for. There also found that there are little effects of screen time on well-being, and there have been tiny impacts found on social skills, but this is only for very, very heavy usage. No, there isn't a universal definition of what constitutes as heavy usage, but to give a rough guidelines, in one study, heavy use was defined as 6 to 7 hours per day, so a very large proportion of children and young people's day, in order for it to count as heavy usage. Even when they were using this internet for 6 to 7 hours a day, this heavy usage, there were only tiny impacts were still found for social skills. Another note about the data is the data does tend to be inconsistent. So while data suggests that there are few effects of screen time, where data does suggest these effects are so small that they're not worth worrying about. There tends to be no link found between screen time and adolescent well-being overall, and evidence is, in summary, suggesting that there are no strong links between screen time, mental health issues, and social skills. It's also important to consider what young people themselves are saying about their own mental health and their own internet usage. So research done by the site Parent Zone found that although there were mixed results, generally, overall, young people do not see the internet and technology as being bad for their mental health. So, taking into account this research that we've just looked at, it's been suggested that it's not the quantity of screen time that we should be concerned with, and instead we should be looking at more about the quality of this screen time and the quality of this internet usage. Technology can be used in wonderful ways which encourage many of the things that parents and education practitioners are worried about children and young people missing at the hands of internet use, such as there are ways that we can incorporate screen time and internet into being active and finding opportunities to share and learn together. And it's been, sort of suggested that rather than disputing and speculating and researching on how much screen time children and young people should or should not be getting, really where we should be looking and where the research should be looking is that it should be more focused on why they are spending so much time online. So while it appears that the overall research generally suggests that we may not have as much to worry about in terms of the effects of internet on mental health as we may have previously thought, there are still a couple of areas I wanted to highlight as being particular risks of the internet for children and young people. And we need to be aware of these and how best to support children and young people that we know might be at particular risk of these things or may be experiencing them as well. So the first one is bullying online. Where the internet does pose risks of bullying online and victimization, these tend to mirror what is also happening offline. So those who are bullied offline are usually more likely to be bullied online as well. Similarly, there is a growing body of evidence that online and offline resilience and vulnerability are linked too. We also, with this sort of growing use of the internet, need to reconsider what we think of as self-harm and our understanding around this, and our thinking in terms of how we support children and young people with this, because it's now starting to take an online form as well, known as digital self-harm. This is when children and young people actively seek out abuse online as a way to harm themselves, and this works because young people see their online selves as an extension of their body and seek out ways to damage their online reputations as a way of damaging their physical self. So, for example, this could be done by creating a fake social media account and sending themselves abusive messages, or deliberately provoking, offending others online in the hope of receiving the negative attention and response that they believe that they deserve. And this makes us think again about how different guidance and boundaries may be needed for different groups of children and young people, and the ways that some will be more susceptible to the negative effects of the internet on their mental health, and therefore we may need greater support for, greater boundaries for, than other children and young people. It's also to remember the positives that screen time and internet have brought for mental health and well-being, particularly in terms of treatment. So 2018 research found that adolescents who report lower levels of social and emotional well-being are more likely to go online to seek support. And screen-based tools can give children and young people more opportunities to access treatment and support than ever before, and remove these traditional barriers that previously may have stopped them from getting this help and support. Particularly the sort of physical barriers of how they would get to treatment if treatment isn't local, and finding increased information, having that information available to them in a way that it may not have been before. So it is worth remembering these positives, and apps such as Calm and Headspace, the website Young Minds, as well as actual online interventions, although they're still in their early stages, they're being constantly developed to improve, so that they're better able to support young people online. Another area I wanted to particularly highlight as well is video games. So just a quick note on video games. The overall message from the research is suggesting that there is not too much to worry about in terms of video games and its effects on mental health and well-being of children and young people. The links between violent video games leading to aggressive behaviour are exaggerated, is what the research is suggesting. Recent research suggests that if there are any effects of violent video games, these are minimal. A note about gaming and addiction. The 2019 World Health Organization included gaming addiction in their drafts version of the International Classification of Diseases. However, there's been no consensus on the prevalence rate of gaming addiction, and also the diagnostic criteria as well. It doesn't reflect accurately gaming habits in the real world. So this is worth thinking about. It's also been suggested that video games are not likely to be addictive to the vast majority of users, and it shouldn't be something that parents need to worry about. It's similar to the way that many people can gamble, they can drink alcohol without becoming addicted to them. It's the same with everything, that too much of anything is going to lead to these negative effects, but in moderation there isn't much for parents to worry about. It should also be noted that children with autism spectrum disorders were found to have higher levels of problematic video gaming, in contrast to their typically developing siblings. And this again calls for us to, when we're considering these sort of boundaries and guidance that we want to put on young people around their internet and screen time, the sort of individual differences between children that we really need to consider, and the variety of factors that make this such a complicated area of research. And it isn't just as plain and simple as saying 2 hours is too much or 1 hour isn't enough. So really appreciating the effect these individual factors can have. So guidance from the experts is saying to speak to children and young people about the age ratings of the video games that they're playing and the types of contents that is in them. Knowing these age ratings of the games that children and young people want to play can be really helpful when it comes to explaining to them why we are stopping them or preventing them from playing these games. Knowing the content that is in these games can also help you to give suggestions of similar games they can play which are more suitable for their age group. There's a link at the end of this PowerPoint or training to a website which lists the ratings and content of popular games that a lot of children and young people are playing. So this can help to open up and initiate these conversations, because parents and educators, we're in a better place to be able to give guidance and advice that is meaningful if we know what we're talking about in terms of the games and these contents. And it'll also make us feel more confident in starting these conversations too, if we feel comfortable with knowledgeable about what we're talking about. So that's a really good website and resource to have a look at. In school, it's also helpful to know the age ratings of these popular games and the content that's in them, to be able to better understand the conversations that it's very easy to overhear around school. And well as in terms of logging safeguarding concerns that you may have. These are all things that it's easier to feel more confident with if you have more knowledge in the area of what these games are and what they entail. So I think a really important area of the internet to highlight when we're thinking about mental health and well-being is pornography and being able to access pornography online and how easy that is to do so. Um, so this is a recent survey done by Internet Matters, asking parents what their concerns were around their children watching pornography and being able to access pornography online. And this just highlights some of the concerns that we're thinking about when we talk about this, and these may resonate with you as somebody that works with children and young people also. I think the really interesting statistic to highlight is that only 54% of parents say that they would have a conversation with their child if they're worried that they're watching pornography. So that as people that work with these children, young people within schools, it makes us think about the fact that we need to make sure the rest of these children are able to get advice and support where they need it concerning pornography and sexually explicit content online. It's also worth mentioning that in 2019, the government announced that an age verification will be brought in for commercial adult content websites, and this is in an attempt to stop under 18s from accessing this inappropriate content. There will be links at the end to new guidance and advice hub and videos with advice in it about how to talk to young people about pornography online.
So, what can we do to support children and young people with their tech use, particularly focusing on their mental health and well-being? It's been suggested the best way to approach topics of internet and screen time with children and young people is to make sure that the conversations are collaborative and supportive. This gives them the chance to explain why they want to do something online, and it also gives you the opportunity to explain why you don't want them to do something online. These conversations will be a lot more effective than reoccurring arguments and battles day in, day out around how much time is being spent on screens and on the internet. So 2019 evidence found that being controlling around digital tech use undermines trust in adolescents and makes them more likely to hide their tech use. This is known as an authoritarian approach, such as things like no more than 1 hour of tech use a day tends to not be effective because children then rebel against this, and this is very dangerous as children and young people may then begin to hide their tech use, which is what we are particularly trying to avoid. It's really important that we avoid this because we want to be understanding what, when, how and who with children are using screen time and engaging on the internet with. We want to know what they're using it for and why they're using it. To give an example of when a similar sort of system has been put in place and hasn't worked, Korea recently tried implementing an internet curfew and found that it barely increased the amount of sleep that people were getting, and instead it increased the amount of gaming, the amount of time that was spent gaming. So there is evidence that this sort of authoritarian approach doesn't work. Instead, giving children and young people autonomy over their tech use, having meaningful conversations with them, that children are then more likely to follow the rules, and are then less likely to hide their tech use, which, as I mentioned earlier, is what we're really trying to avoid here. The more we understand about their tech use, the easier it will be to manage and to have these conversations with them. So, for example, telling a child that they've got 5 minutes left on Fortnite could lead to disagreements, because without having an understanding of Fortnite, you may not know that a round can take a lot longer than 5 minutes to finish, and then by leaving that round halfway through or by leaving the round early, you're then having to let your friends down by dropping out of that team that they're playing with. Whereas if you reframed this and asked them to finish the round and then come off, you're a lot less likely to be faced with confrontation, and this all comes from having that good understanding of games and what the content of games is. Finally, getting a better understanding of the types of screen time children and adolescents want to engage in can help generate these positive conversations about the types of use. And this is something that could be, for us as educational practitioners, something we could consider to incorporate into the school day, perhaps in citizenship or PHSE lessons or circle time, and discussing the different use of tech to give us better understandings of what they're using tech for, why they're using tech, and this could always be fed back to the parents in the long run. As said previously, giving individual guidelines relies on knowing contextual information about each child and each young person. Parents, carers, and us working with these children and young people in schools are the ones holding this contextual information about children, and therefore it's really up to us to use this information and know what we've spoken, and knowing what we've spoken about the importance of individual factors. We know that we are then in the best position to decide on how much screen time and internet usage particular children should be getting, and what they should be doing with this internet screen time, and what's appropriate for that child specifically. Just remember, when we're thinking about these things, to always include the child or young person in the conversation. Make sure the collaborative conversations that include them.
So, just to summarise what we've talked about today, I think the main messages to take home are that while a small proportion of children and young people may have difficulty regulating their screen time and their internet usage, across the whole, there isn't too much to be worried about. That's sort of what the evidence that we have at the moment is suggesting, is that there are small effects, if any, of internet and screen time on mental health and well-being in children and young people. If you do feel you need extra support or guidance for any of the areas we've covered today, there's a list of resources on the screen now, along with links to these websites. Young Minds, they have a series of blogs helping children and young people to become more digitally resilient. Parent Info offers help and advice for families in the digital world, and activities and ideas for boosting children's digital resilience. Parent Zone offers free school resources on digital resilience, as well as free tech guides for parents. They also offer a mental health in the digital age conference, which is really interesting to have a look at. This discusses young people's mental health and the internet. They also have articles on how you can support a child if they're being bullied online, and expert reviews of all the popular gaming platforms and apps as well. ChildNet, they're working to make the internet a great and safe place for children, including resources and advice for parents and school staff. WebC have information, advice and resources for both education professionals and parents on a range of internet safety issues, including managing your online wellbeing. The Mental Health Foundation offers guidance on talking to your children about a healthy internet use. InternetMatters.org, they explain the ratings of video games and apps and what these ratings mean. And Ask About Games and Common Sense Media also review popular games and the kind of content that is included in them. I hope today's training has been useful and provided an insight into where the research is in terms of children and young people's mental health and wellbeing in terms of the internet and screen time. Thank you for listening, and take care.